hospitals work exclusively in paediatrics? Oh, so about half-half. And so I know Sydney Kids is here, Children's Hospital Westmead, Royal Children's is
Testing.
here? Oh yeah, I'll use this one.
Yeah.
Anyway,
Okay, let's try and start on time.
Monash Kids. Oh, awesome. And for the rest of you, just a little bit of data that I always like to tell people. The children's hospitals don't see the children, you see the children. In New South Wales, over 1 million paediatric presentations to emergency departments will happen this year, and only 20% of them will be seen by specialist paediatric emergency staff. So we don't look after the children. It's our job to help you look after the children. And in that theme, I'd like to welcome you to this session, which is really all about paediatric injury and paediatric resuscitation and the differences that nurses are making in that. And the first person I'd like to bring up here is somebody that you've already been introduced to, I think, about 3 or 4 times. So I might leave out all the numbers, except to say that Kate's been about 19 years at St George ED and she's now working in Wollongong ED. I suppose the most extraordinary thing about her is that she's completely legitimate in terms of being a clinical academic. She spends half her time in the clinical environment and the other half trying to make that environment better. And there's probably hundreds and thousands of nurses and people and children now who've been affected by the work that she's done. It's internationally renowned. There are many, many papers. And this presentation is about a huge piece of work that's involved many, many people that Kate is driving. Come up here.
Okay. So I'd like to acknowledge my co-authors on this paper, Kim Foster, who you heard speak brilliantly earlier on resilience and the things that we actually need to help us be resilient, and Rebecca Mitchell, who did the lion's share of work around this. But also none of this would have been possible without the funding that we received from the Day of Difference Foundation, which I don't know if any of you remember the Sophie Delezio story where she's asleep in her daycare centre and a car ploughed into that centre, and she sustained pretty horrific injuries and a lot of burn injury. And then when she was walking across a pedestrian crossing in her wheelchair with her carer, she got hit by a car again a few years later. So her parents set up this foundation to try and help parents of severely injured kids, as well as try and do something about childhood injury in this country. So they commissioned this work. And that's Tennille's son on the front there, who got injured and is in our statistics here. Thanks, Tennille, for the photo. So the purpose of this study was to try and work out how many kids are actually getting injured in Australia, where they're getting injured, and if there are any trends in particular types of injury. And then what happens to them? Are they surviving? Are they coming back into hospital multiple times? The reason we needed to do this is because it hasn't been done before in this country. So how on earth can we prevent childhood injury or know where to target particular injury prevention strategies if we actually don't know where and how and why they're occurring? So that's what this project is. The report's available online, and if you want to have a detailed read of it or use it as a resource, and we've also published it open access in the Public Health Journal there. So I'm really just going to summarise the report, but also like that so what question, what are we actually going to do with all of this information? So it took us a long time to get this information, and this is what hasn't been done before. So we wanted to get every single child injury presenting to hospital in this country, public hospitals, private hospitals, and it took us 4 years to get approval from all of the hospitals and states to actually give us their information. In Western Australia, for example, we had to write to the chief executive of every hospital and ask for their permission to have their information, which is just ridiculous because this information's actually being collected everywhere. It's going to the government, but no one's ever allowed to put it together because we're not allowed to look at individual things to link things. It's complicated, but needless to say, the barriers were amazing, and there were, we almost gave up a number of times, but we'd come so far and it was too important to not do. So we looked at all kids under the age or equal to 16 for a 10-year period. And the reason I'm presenting this in 2017 for the first time ever is because of that 4-year process to actually get approval to use the info. We also categorised people as to where they lived at the time of the injury, rural, remote, regional, and we looked at their injury severity and what their causes of injury were, how long they were in hospital, that sort of stuff. We just did basic descriptive stats to describe where the injuries were happening. We wanted to look at rates, so we used the ABS data for population rates, and then we wanted to look at specific things like what influences mortality in these children. And to do that, we used a series of type of regression analyses, and Rebecca's the statistician, not me, and she did that. All the while, we are getting hassled by the funders because they need this information to lobby for change. So I kept getting phone calls from the funders who don't really understand why it's taking so long. Rebecca's getting frustrated having to deal with government departments, and it was a little bit like Charlie and the Chocolate Factory and quite surreal. But we got there in the end, and I seriously cracked a big bottle of expensive champagne when I knew that we had that final lot of data. Once we got all of that information, it only took us 6 weeks to put it together and analyse it and generate the report. So nearly 700,000 injuries in our children over the past 10 years. There are more than that, of course, that would have gone to a GP and that didn't even come to a hospital or a GP service, and this includes kids that died before they got to hospital. It cost our country $2 billion, which is pretty huge, and males, no surprise, were more injured than females, and of course the most populous states, New South Wales and Queensland, had the highest proportion of injuries. And 70% of it, and this is an important number to remember, 70% of the kids that got hospitalised following injury actually came from urban, so a big city environment, capital city environment, not rural like Wollongong, for example. Not that Wollongong's rural, not regional, sorry. So this is the slide that we are using to take to government now. Over the past 10 years, look at that green line in the middle, nothing has changed. We are not doing any better with preventing injury in our kids. And that's devastating to me as a parent of 3 children. And what are we doing as a country if we're not doing anything about injury prevention in children? So that's quite a powerful slide that we're using quite a lot in our lobbying, which I'll talk to you about in a minute. If we want to look at the severity of injury, is it, yeah, sure, it's okay, we're not changing the number of kids that are getting injured, but because of all those wonderful things like helmets or wrist guards, they're not getting as seriously injured. Well, that's not the case. We're not seeing any change in the seriousness of injury either. If you want to look at state by state, I think that's quite useful information because, so for example, in the green, the Northern Territory is getting worse. They're getting more injuries. Western Australia is getting worse. Queensland had that quite nice big dip, and that was at the time that Queensland government were putting millions into injury prevention campaign in Queensland, but that funding stopped with the previous government. And then other states are there's just that slow increase. We haven't done more detailed analysis about what's happening individually in terms of mechanism of injury and things like that in the individual states because we don't have any more funding. Probably no surprise to you that falls are the biggest cause of injury. That's and within that falls group, it's falls from playgrounds that are causing the most injuries, followed by road transport. But one of the things that's quite concerning is you look right down the bottom there, that other and unspecified injury mechanisms. So there's quite a large group of kids we actually don't know what's causing their injuries, and if we don't know what's causing them, how can we stop it? We talked a little bit about fall, but we've got the slipping and tripping, but you can see that big massive one in that 6 to 10 year age group, that red line in playground equipment. Ice skates, I don't know how many ice skates we have in Australia, but so I think it's probably more skateboards and roller skates. I don't even we haven't had roller skates since the 80s, have we? So I think it's skateboards and scooters there. And then just in the younger age group, it's the little kids, the toddlers, they're learning to walk and they fall over. It really depends on how old you are as to what you're most at risk of in sustaining that injury. And that's the sort of information that we can get out of this to know where to target certain injury prevention campaigns. And we can delve down further into this and look at particular postcodes or where people are living to know if we need to target certain areas. The road transport, again, it's that age group. The pedestrians tend to be that younger in the blue, that 0 to 5 age. Once they start getting a bit older, they're out on their trail bikes and stuff like that, on their and the motorcyclists there, and pedal cyclists when you're learning to ride a bike, riding on the road. They have kids until they're the age of 10 or even older. I mean, I've got kids, so I can say this, they're a bit stupid in terms of roads. They've got no road sense. Their brain isn't developed enough to have that road sense, so they get hit by cars. But do we enforce helmet use in children? No, we don't. And where did they get injured? Home, a lot, but again, the data, it's a bit sad. Again, we don't know where they're getting injured in a large proportion of kids. So are they surviving their injuries, and even though our injury rates aren't changing, and just not dying as much because our healthcare has improved in this country? No, they're actually dying more. When we even adjust for severity of injury, location of injury, things like that, there really isn't much difference at all. So not only are we not preventing injury from happening, we're not preventing them from dying, they're dying more. Who is at most risk of dying from their injury? The standout groups here, this is a no-brainer, that's a serious injury there, that if in that injury severity column. But the younger age group, 0 to 5, and kids that are injured in transport-related incidents. And this is the scary thing, regional remote, they're much more likely to die from their injury than kids who sustain their injury in a city, urban environment. If you get a head injury or a chest injury, you're more likely to die. And again, there's so much more to be done here in terms of delving down into this information that we just haven't been able to do yet. But we have a plan for that. So we've got some pretty big numbers. Those numbers, we don't even include ACT prior to the 2004 because they just didn't have the information to provide. 20% of the Victorian data couldn't be included because their data processes were just not in place to be able to do that. And we couldn't include the costs because, again, it wasn't collected in Tasmania and ACT prior to that. So those numbers that I showed you right at the front, they're bigger than what they are because of these limitations, but we couldn't guesstimate because that would just not be the right thing to do. It also doesn't, it's just the hospital costs, it doesn't include parents having to take time off work or lose their jobs because they're looking after their kids, or the transport to hospital, having to pay for accommodation when they live out bush, and it doesn't include your physio when you go home, or whatever equipment you might need to buy for your injured child. So this is where we're going with this. We've got this incredibly powerful information for the first time in this country. And what it showed is that injury is the leading cause of death in our children. It results in twice the number of hospital admissions due to cancer and diabetes and cardiovascular disease combined. And it's not getting better. If anything, it's getting worse. And we have no injury prevention plan or action plan or framework in this country. It just doesn't make sense. And kids who are living regional or remotely are more likely to die. I live in Wollongong. That's a regional city. My kids are more likely to die than if they have their injury in Wollongong than if they do in Sydney. And they're more likely to get injured if they live in an area of socioeconomic disadvantage, and that also will come as no surprise to you. But that doesn't mean we shouldn't be doing something about it. So what are we doing about it? These are the key points that we're taking to the next phase, which is trying to translate this information into action. We are trying to develop a communications campaign with a PR company who I'm meeting with tomorrow morning. Hopefully, they're actually based in Surrey Hills, and they're going to do some work for us for nothing, which is great. And we're trying to, not that we're trying to diminish the terrible other illnesses in kids, but we're trying to put it in perspective. We care so much about food-related anaphylaxis death, but there have only been 14 in 16 years. We get more than 130 deaths a year in children from injury. Asthma, we get 11 deaths a year versus 130. Cancer, 710 are diagnosed each year, but we've got 60,000 kids coming to hospital each year with injury. So what we're trying to say is that we know that you can do things like to reduce stuff. So in cancer, for example, since they've put all this money into funding cancer research and cancer screening, there's been a 38% decrease in the incidence of melanoma. We all know about slip, slop, slap. We need to do something like that for childhood injury so we can see that same sort of reduction. And that's where we're going to be working quite closely with this media company, and we're going to be getting the behaviour change people in as well. We are looking for funding at the moment to employ a project person to kind of drive and coordinate this. At the moment, I'm trying to lead it in my spare time, along with other people in this room who are very much part of it. But it's a full-time job to do this. Well, it's probably more than a full-time job, and that's what we're looking for at the moment. So I've had a couple of meetings with potential philanthropists at the moment who, and I have a report in a request for funding for a position at the moment, and I'll hopefully find out about that on the 1st of November. So, Belinda, your workload might decrease at that point. The other thing we're doing, so that's kind of the community campaign. We really need to get the community on board to make it an issue and make it a problem. We talk a lot in primary schools about awareness. Everyone knows you can't take peanuts to school in primary school because of anaphylaxis. Kids get EpiPens. I know they might have to pay for them, but we need to do something like that in injury so that it's a normal thing to try and prevent. We have written a proposal to the federal government. We have met with Minister Greg Hunt a month ago, and what we are asking for is $10 million over 10 years to set up to actually have an injury prevention strategy and framework, but actually fund it so that we can do things to implement change. And as a business case, which might be a harsh way to look at it, we only need to save 2 major head injuries, and that's funded the whole 10-year program. So it's not really that hard from a business case perspective. So this is all about the cell. But federal government won't do anything unless they've got state government support. So at the moment, I'm meeting along with Susan Adams, Rebecca, whoever else from each state. We're meeting with each of the state health ministers. So this week I met with New South Wales. I went to Queensland last week, and I'm going to ACT next week. And then we've still got Tasmania and South Australia to go. And they need to take it to COAG to try and get it on the national agenda. So we want to go from having 60,000 kids a year, that's Allianz Stadium, 60,000 people, down to next to nothing in the empty stadium, and that's our goal. Thank you.
Is child protection non-accidental injury included in that data?
Yes.
Yes. Did we see any change in drownings at some point? Do you know what I mean? I sort of felt that there was a drop in drowning.
It goes up and down. You see the sorry for interrupting.
Sorry, so let me,
injury
like I've just
included
done
in
the
that
research
data?
case on
Yes.
this question.
Did
You've got to
you
give me
see
something
any
after 4 years of pain.
change in drownings at some point? I mean, I sort of felt that there was a drop in drowning.
There has been a decrease of about 1%, and you're right, Kay, it was a dip, but let me, like I've just done the research case on this
And
question.
then my last question is anyone overseas doing anything better? Like,
Yes,
do you
that's
know
an
that?
excellent question. Are overseas people doing? Yes, so there's the European Child Injury Prevention Alliance. They've actually got a good practice guide about what we should be doing, and their funding implementation strategy around it. New South Wales Health has also come up with the same good practice guide for injury prevention. We actually know what works in terms of injury prevention and how to do it. We just need the funding to actually put it together. So that's alongside with all those meetings that we're having with government. We're taking the stats, but we're all saying we know what we need to do. We just need funding to do it. Yeah.
I just wanted to know, obviously, that data's about injuries, but did you look at anything where, obviously, we see children who were doing everything right, they had helmets on, but they had a horrific injury. Did you look at the data to pull out who was doing things that, say, weren't wearing helmets versus wearing helmets or taking the appropriate safety precautions?
That information is not available in the country at all.
Right.
There are some more detailed trauma, like the trauma registry and the National Trauma Registry that's being developed, which we've just got some funding for, and that looks at that quality of care level. So, but again, it's a funding and resource problem. So it's the data's being collected at the moment, but it's not being analysed, and some hospitals aren't even able to provide the information to the National Trauma Registry.
Another project.
It's another big project.